So if you're a newbie that's just looking to start the TRT journey, testosterone replacement journey, you might have some questions. You might wonder, what does it entail? What's life like? What will I have to do? Are there side effects? What's the best way to go about it? We're going to answer some of those questions after this, so keep watching. So I'm here with a special guest here in London with Dave Lee. Dave Lee is a health coach, very prominent in the space. He's spoken at the Silverback Summit as well as the Mr. Olympia on a roundtable panel, one of the TRT experts. And we're going to talk about what TRT entails for the newbie. There's a lot of, anxiety or apprehension for some people that go through, get started on testosterone treatment. There's a lot of misperceptions and misconceptions around what testosterone replacement therapy is. Dave coaches a lot of young men or men just starting off on TRT, or helps troubleshoot for them along with the clinics. So we're going to have a nice conversation, see what it's about. So thanks, Dave, for coming all the way over here from Lithuania, and good to have you over. And let's, start with what maybe we'll talk about 4 or 5, and just a conversation. What do you think some of the big topics, concerns are for patients that you talk to when they're starting or looking to start TRT?
Yes, that's a good question. I think that there's a few categories that we can kind of break that down into, and I think that the first one that would be on most people's minds is that it's a big trigger to pull. And I think it's a big trigger to pull both in terms of the positive outcomes that can come from it. When people talk about going on TRT, when they look back on it 3, 4, 5 years down the line, they go, this was a catalyst for me to make a huge amount of change, not just in my health, but my mental health, my business, my relationship, physical strength, all these different things. It can be a fantastic catalyst for change, but it's also a huge commitment to make. And I like to use the analogy that you're basically becoming a type 1 diabetic with testosterone. You're firing your body's natural production and you're doing it yourself. And if we think about a business, let's say it's some kind of, I don't know, maybe a box factory. We're in a factory, right? So let's say it's a box factory. You're only as successful as a business, and you're only able to have the output, you're only as strong as your weakest link. So if you've got someone in the chain of assembling these boxes who's not doing a good job, the first thing that you want to do is train them up to try not to fire them. And that's what people need to be doing. They need to go, how can I try to optimize my natural production as much as possible to not need to do interventional endocrinology? But if you're in a situation where this person, or in this case, this organ in your body, is not able to meet the demands for you to actually have optimal health, then you may be in a better situation to fire that person and do it yourself. But then you now have the responsibility for the rest of your life to then replace this hormone that your body is no longer producing. So it's kind of like it's like the Spider-Man thing. It's like great power, great responsibility. And I think that it is, in terms of the juice, is absolutely worth the squeeze. I mean, a couple of injections a week, or if you're doing cream 1 to 2 times a day with a small tiny little insulin syringe to get the outcomes that you get from TRT, like, there is no supplement or dietary intervention or any biohack that you can do that will come close to testosterone replacement therapy. But it's something that if you don't do it right and you don't look after your health properly while you do it, you are likely not going to have your expectations met, and you might also have a bit of a bumpy ride. So something that I coach guys on is making sure that it's the right call for them and making sure that they're going to have their expectations met. They need to be realistic. But the biggest thing that I see holding people back, and this is something that I spoke about at Silverback and that I make a lot of YouTube content on, is that if you are not, and this is the bottom line of what I speak about, is that you can't take the levels of a healthy man in terms of the testosterone and put it into an unhealthy man. You can't take a sports car engine and put it into a Suzuki about to fall apart and expect it to become a sports car. It doesn't work. And this is what causes a lot of people's side effects. So I think that it's very important that when guys are starting TRT, you're not going to be a sports car when you start it. You're not going to be a healthy, that's why you're here. Like, you're unhealthy, but you have to work with the medicine to be able to get you to the point that you want to get to, not just expect that it's going to do that work for you. And I think that that's something that guys need to really understand before they start, is that this is going to help you get the results that you deserve from the work that you do, and nothing more. And I think that that's a really important point.
So what have you seen as far as mistakes that some people have made when they they first start. I guess the assumption, and I think we spoke about this on a previous video, one of the mistakes, we thought they had this unhealthy expectation, especially if they didn't have anything right going on with it. So if they weren't doing all the right things to keep their health, diet, the exercise, a proper sleep. What are some of the things that you've seen why people kind of, their expectations are misaligned?
The big ones that I talk about, I often like things in threes, and this is four, so that annoys me, but drugs, alcohol, junk food, and not enough exercise. That is not what causes all the problems on TRT. There are outliers, there are pre-existing medical conditions that are complicating factors or undiagnosed. There's a huge amount of things that guys deal with, and I often coach them on those things. That's why they come to me. But for the majority of guys who are not getting their expectations met, it's drug use, too much alcohol, too much junk food, and not doing enough exercise. And these can be difficult things for guys to understand in terms of their expectations because, and this is again something I spoke at Silverback, without getting too esoteric, is that we are embodying a vessel. We are experiencing the human body being alive. And we're also interacting with a bunch of other people who are also doing that, which creates this complicated world that we live in. But we cannot expect to feel healthy and feel well while being physically unhealthy. You can't have good mental health and poor physical health. It's impossible. It would be a paradox and it would be a contradiction. And I think that this can be the really tricky thing for guys to wrap their head around is that if you want to feel good and you want to perform well, and guys often come to me, they say, and they probably say it to you as well, they want good healthy libido, they want good energy levels, and they want to get rid of brain fog, and they want to look good naked. And I think that that's all stuff that, yeah, that sounds good. You can't treat your body like shit and have that happen. It's just not going to work. And I think that we all know someone who gets away with it. Like I remember being in my early 20s and I knew guys who would party all weekend and eat junk food all week and they had abs and they'd be healthy. And, you know, we've all heard of someone who, you know, smoked a pack of cigarettes for their whole life and lived to 100. Outliers don't prove rules. So I think it can be difficult for guys to wrap their head around just how well their daily habits have to be in alignment with the person that they want to be. But I also think that once you start to, and this is the tricky part, and this is the stuff that I understand well. I mean, we've both had low testosterone before. We've both come through this journey. You've been on this for longer than me. I've been on this for coming up to 7 years. Is that it's very difficult to do the right thing when you're sick. When your body's sick and when you feel like crap, it is very difficult to do the right things for yourself. And we will often seek and be drawn to these path of least resistance, hedonistic vices. You know, I feel like crap, my energy sucks, I've had a terrible day, I'm going to have a few beers when I get home from work. And that makes you feel worse the next day, but you're not really thinking about your future self because you're suffering now. And I think it can be very difficult for guys to make this catalyst change with the TRT, which is the easy part. The difficult part is going, okay, I need to leave all these maladaptive coping mechanisms behind that I have formed from suffering and embodying something that's suffering and actually healing from that. And I think that that's stuff that's difficult because if you've been to the, like, and this is something I see all the time is guys will go get a personal trainer, they'll go to the gym, they'll be hypergonadal, they'll eat their 2,000 calorie diet with 150 grams of protein, and they'll do their 3 resistance training sessions a week and their cardio, and they won't lose weight because they're hypergonadal, their metabolism's shot to shit. And their personal trainer will say, oh, you know, you're not tracking your macros properly, you're not counting your sources, you're whatever. And if you've gone and done that 10 or 11 or 12 times and it hasn't worked for you, it takes a huge amount of courage and bravery and resilience to go, I'm going to try that thing that didn't work 10 times and then the 11th time it's going to work. That's not easy to actually do. That takes a lot of strength. And I think that that's something that's actually very difficult for guys to actually go through with is actually executing. It's one thing to understand that you have to stop drinking, stop the drugs, train more, do all this kind of stuff, but to actually pull through with it and become that version of yourself that you admire and respect and look up to, I think that's a difficult, long process to go through. And testosterone might make you more disposed towards wanting to do that. But when that alarm goes off at 5 o'clock in the morning and it's freezing cold in London in winter, it's not getting you out of bed. You're still going to hit snooze.
You know, yeah, it doesn't change your wake up pattern necessarily. But I suppose Some will say, and I've seen some of these videos, and usually they're coming from personal trainers out there, saying, well, the people who are on testosterone who shouldn't be on testosterone. And I guess the question is, if someone's tried the exercise, the diet, they tried all the right things. I mean, how many have you seen that have been able to turn around the levels in a meaningful way to where they didn't need testosterone treatment? I mean, I've not seen too many, but then when they come to us, because they've tried all these different factors. I know you coach other people. Do you coach others who, they want to get into the highest levels of the natural levels, or are you too seeing them once it's too late?
I see both. I predominantly see guys who are wanting to go down the TRT path, but quite commonly I see guys, and I think there's different categories of guys who come to people like us. And one category is, I want to go on TRT because I want to optimize my natural production and I have low levels. Cool. There's also guys who go, I would rather not be on TRT, but I need to fix this problem. And I think that both of those are fine. And if you're in this category, I think that the advantage of doing the diet lifestyle modification is that you're going to have to do that if you go on TRT anyway. So it would be good to at least start that process. The thing that I think is idealistic and that is something that is based in mechanistic theory, not in outcome, is that if you have been morbidly obese for decades, or if you were morbidly obese during development, the idea that your natural hormone production is just going to magically recover out of nowhere if you spend, 3 to 6 months training properly and getting your body fat down. I mean, that's just something that we don't have this research to understand this, but in practice, what I see is that if your habits are shot and you're hypergonadal and you've been hypergonadal for a long time, you may be able to get your levels up a little bit if you turn your shit around. But if you've been hypergonadal for the majority of your adult life, there's a very good chance that you can start to live like an absolute monk, or you can do everything perfect. And then people will disagree about what perfect is. But you can, and this is something I see a lot. I see guys come to me in their early 20s who are doing everything right to the point that it's kind of weird. Like they are living the perfect biohacking lifestyle, and their testosterone levels are still that of an unhealthy 80-year-old. And it's a very typical avatar that I get of the guys who I call the biohackers, or they call themselves that, is that they have to do everything perfectly just to not feel shit. And
So what kind of life is that?
yeah,
Or is watching every little thing, because that brings its own anxiety into the picture. Doesn't make life that enjoyable if you're that high strung about it.
and you're not getting the outcome that you deserve from all that work you're doing. And I think it's great that they're trying to solve the problem, but I also think that it's imperative that they get to the point, and they often do, which is why they come to see us, is going, I'm doing everything right and it's not working. And I particularly see this in guys under the age of 30. And maybe this is because of the modern lifestyle that we've been brought up with. Again, things in threes, plastic pollution, pesticides, all of these things are combining in terms of factors. And they're at a point where they need an intervention. And maybe I'm biased, but I'm a big fan of the idea that if someone needs a health intervention and they're doing everything right, that bioidentical hormone optimization offers the most benefits and the least side effects. But it does come with the responsibility that you are going to have to do this long term. But you go on an SSRI for 10 years and you try to come off that and see how you go. They don't tell you that part.
No, and not to mention some of the other side effects of SSRIs that they don't always talk about either.
Yeah.
Even on the heart, the negative, the effects of SSRIs and the affecting heart valves, etc. That's a good point. Now, I guess there's a certain group of people that always argue, well, I've got to be on this for life.
Mm-hmm.
And we've always argued, we've always said, well, but you can also have low testosterone levels for life. And yes, it is a shame that, the biology that you're supposed to have is so different to what maybe your grandfather had or great grandfather had. And we've mentioned this before, that it's almost this epidemic of people having these weakened hormones, and it's frustrating because it's no fault of anyone's necessarily. It's not always their lifestyle and diet. And I know there are some gurus or people who feel like you're not working hard enough, therefore you're not doing the right things. And if it's just you got your diet on point, but we know that's not the case. So I guess it's almost like a psychology that patients shouldn't beat themselves up because they've arrived at this point where now they need medical intervention. I mean, I just find it's there's a whole group of doctors out there, the endocrinologists in particular, who, not everyone, but many of them, who dismiss many people who are put on hormone treatment. They'll kind of mock the other societies that talk about functional testosterone deficiency, or they'll talk about low testosterone, and the only sort of diagnosis that they prefer to call it is primary or secondary hypogonadism, and anything that falls outside those very narrow definitions, it doesn't seem to be a real issue with the people that you would think should be the experts in it. So I suppose the whole field is changing, and I just I want to know what your thoughts are about these sorts of people. I guess we can. My thought is just let's ignore them. They no longer deserve the right to be called endocrinologists, and just leave them as mediocre diabetes specialists. But you might have your own take on it.
I think that that is a great term for endocrinologists, is mediocre diabetes specialists. You would think that if you go to someone who is a endocrinologist, that they would be experts in the endocrine system. If people have gone to an endocrinologist, they might have found out the reality of that situation. I think that when it comes to the term hypogonadism, meaning deficiency of gonadal hormones, this idea that it's either primary or secondary is something that was maybe true prior to the 1970s, maybe. But there's been some point in recent history, and I don't know exactly when it was, but let's say it was the start of the noughties, for example, where now we're seeing this cluster of these other guys in the middle. And I would say that this is the majority of the guys that I work with. It's probably a decent chunk of the guys you work with as well. If you're 70 years old, you're going to have primary hypogonadism. Absolutely. You're going to have andropause. If you live for 70 years, you're going to have andropause. That's just the way it is. If you are chronically stressed, morbidly obese, and on a bunch of medications, you're probably going to have secondary hypogonadism. Your body is shutting down your natural production because it's focusing, number one, on survival, and number zero, on reproduction. There's a whole bunch of guys in the middle. And what we see in their blood work is they have mid-range gonadotropins. The luteinizing hormone level is not jacked to suggest that the testicles aren't functioning. It's not suppressed to suggest that the body is shutting down natural production. It's 3, 4, 5. And their testosterone levels are completely garbage. So we're in a situation now where the body is going, this is a good amount of testosterone for us to be making, but it is of the level of a geriatric sick man. And I think that this is really tricky when guys are looking at this going, well, hang on, I'm in my early 20s, late 20s, maybe early 30s, and okay, my testosterone levels aren't completely zeroed out, but they are so far from optimal, and I'm having these negative symptoms. I'm not doing well. And the point that guys get to, like I said before, is they get to the point where they go, I need an intervention. I need help. I'm not doing well. And to dismiss that and to put them in a category of going, oh, well, you're just wanting to get big in the gym. You're just wanting to have this or have this, or it's something that it's so harmful to these guys because they're going to the doctors. They've got the hypergonadal testosterone levels. They're not suppressed. They're in a situation where there's nothing that they can really do that's going to move the needle to significantly change the levels. It might bring it up by a little bit. If you eat perfectly, sleep perfectly, stop drinking, all that kind of stuff, it'll increase. But if you're low to the point that you're suffering and your body is not suppressed, we're in this situation where people are just not producing the amount of hormones they should be based on what they're doing. And it would be great if we didn't have to intervene and go, okay, we're going to replace the production with testosterone replacement therapy, but what's the other option? And it's the thing that we see, and I'm sure you see it as well, is like, I absolutely adore the work I do. I am so blessed to do this because the conversations I have with guys every day, I mean, I get goosebumps talking about it, is that the changes that you see in these people, not only in their objective health, all their biomarkers improve. Every single biomarker that we look at improves as long as they look after themselves properly. But they are subjectively going, I feel fantastic. I feel much better. I feel the way that I either feel how I used to feel or I feel the way that I've never felt before. And they're subjectively healthy. They're biologically healthy. They're putting something into their body. I like to call bioidentical hormones. It's like I don't think anyone probably uses a Windows computer anymore, but it's like installing Microsoft Office on a Windows computer. It's part of the operating system. It's meant to be there. And it works so well because you're working with the body, not on the body. You're giving the body what was meant to be there all along to create a bioidentical environment that is going to allow you to thrive. And does that come with some slight drawbacks of, yes, you have to continue to monitor your therapy, yes, you have to continue to administer it, but like we spoke about before, sometimes when something like that happens in your life and it forces you to go, okay, now you have to get comprehensive blood work every 6 months. Now you have to stop drinking and doing drugs. Now you have to start going to the gym. Is that bad? No.
Because you feel better from it, and the studies of exercise is actually as helpful, if not more helpful, than some of the antidepressant medications. Yeah, yeah.
Yet they get outperformed all the time.
Yeah, so metformin, and I guess that's jury is still out. Some people say metformin for anti-aging or for other reasons that has its benefit, but in combination with exercise, it works quite well. So if you're considering testosterone replacement therapy, TRT, why not reach out to one of our doctors at Balance My Hormones, where you can get just a simple advice call for only $59.95. Also, whilst you're watching the channel, don't forget to subscribe, like, and hit the notification bell so you get the latest content from Balance My Hormones. Until next time, this is Mike, and wishing you the best of health.